Hello, everybody, and thank you for joining this amazing course brought to you by Dr. Jill Wade, Top 10 Secrets to a Progressive Wellness Practice. And what that means is a whole bunch of things. And Dr. Wade's going to go over her systematic approach to a very successful wellness practice that she has in Frisco, Texas, called Stonebriar Smile Design. That is where I worked for many years, 5 amazing years with Dr. Wade, and we did amazing work there too. I mean, I keep saying amazing because that's how I felt every day when I went to work. She has an amazing approach to the way that she does dentistry, and she looks outside the box and she incorporates wellness. So we're saving lives all the time. And she inspired me and our Smile with Heart team to write a great book called Hygiene with Heart. And that is the team there that participated in writing this book. And I'm so honored to have you speak on this and do these courses for us, Dr. Wade. And thank you again for being an outside of the box thinker and an amazing lady and an amazing influencer. So I'm just gonna go ahead and take it from there. You can take it from there.
Oh my goodness. Thank you. You're so sweet. And it was fun times. Believe it or not, pre-COVID. I mean, come on. I don't even know if I remember pre-COVID anymore. Like it seems like a whole lifetime ago. And yet I really truly believe that right now, probably even more important than prior to what we've all gone through in the last couple of years, this information, this process, this kind of way of practicing is probably more important now than it even was back then. And it was pretty dang important back then. So I'm super excited to be here with you. I want you to participate in this with me because you've practiced like this right alongside of me. And so today, all I really wanted to do was kind of scratch the top of the surface as far as what is possible. Like, what's the possibility of what you could do in your own practice? How can you be progressive these days with a wellness mindset, with a wellness focus? And so we're going to go through, like I said, those top 10 secrets. But to me, now is the exact right time. Like, there's no better time. Being progressive and embracing dental wellness can not only, I guess you would say, kind of reignite the fun and the passion that you have for our profession, but it also really can help the fundamental success of a dental practice, because I think all of you would agree that having a very strong dental hygiene program and empowering your hygienists to do what they were, taught, trained, and educated to do is what every practice needs to be doing. And I think that's a very important, especially these days. The evolution has gone away from you guys being pickers and flickers, right? And you're really a huge part of the progressive thought process of a practice, because we need to think of you as providers, educators, really the first line of defense in getting somebody well. You're the ones that spend the most time with them. You're the ones that influence them the most. As far as I'm concerned, the hygienists do that the most. Obviously, the doctors come in and we should, place you guys up on a pedestal and have conversations with you, but you have more time with them actually being able to talk and educate them than we do as doctors. So we need to all understand the really relevant science behind what's going on. Everybody needs to understand that. And the doctors need to think about the business success and the concepts that are along with that to support the hygiene department. Does that make sense? I know Aurelia was in dentistry for a long time, right, Aurelia? So you've been in progressive practices other than just mine.
Mhm.
And the real successful practices, I feel, empower all of the team for all of their different parts and pieces, don't you think?
I agree completely. Yes, I have been in dentistry more than 27 years now, which seems unbelievable. And my history, my uncle was a dentist, is a dentist still in Southern California, and he was very, very progressive. I mean, he went through fellowships and masterships just like yourself. So I was very fortunate to have a comprehensive dentistry embedded in me at a young age as a dental assistant, not just not a hygienist. I later went to hygiene school in Texas, where you're at, and that's how we met. So yes, comprehensive dentistry has always been in my training. So yes, when I went to your practice, it's comprehensive, but it was beyond, and I had to learn a lot more than what I did with my uncle, and in a different way.
But all based on science.
That's right. Yeah,
Right? All based on
completely.
science, completely based on science.
Yeah.
So we together created and designed a Smile with Heart program, which is really that comprehensive aspect to approaching. Basically, one of the main goals is to approach heart attack, strokes, and diabetes. And as much as I love everybody's 32 teeth, I do. I actually love their one heart the most. And we have to do our part to protect that. And so when Aurelia mentioned a few minutes ago about literally we're going to work every day and we're saving people's lives, that's the why behind what we're doing. And if you keep that into perspective and you realize that people are dying from heart attacks and heart disease, it is the number one killer of all other things. All cancers combined, heart disease and heart attacks are still the number one killer. And we've got to get that number to start going the opposite direction. Instead of going up, 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 we need to get it to turn around and go down, down, down. I could go off on that for quite a while, but I'll save that for another slide. And yes, Aurelia was part of this great team who really started and designed the Smile with Heart program. And those are some happy, empowered hygienists right there. And they love what they do, and their passion for what they do is palpable in the office. And if you guys can't feel a strong, positive, confident group of hygienists in your practice, not divas, not diva hygienist, okay, but really people who are confident in what they know and their skills, and that they are helping their patients when they're talking to them about what they really need to have done. It's a huge difference. It's a different energy inside the office itself. And because of that energy, it's really the foundation, like I said, that builds the whole rest of the success of the practice. This crazy little critter came up to us and really knocked us all in the face, in 2020. And for some of you, you may still be struggling, and you may still be trying to survive kind of through what is going on. I'm just here to tell you, it's a choice. You can either stay with what you're doing and continue to struggle, or you can make a choice to try something different and to really embrace this. All you need is one other team member on your team to really get going after this. And if that's a hygienist, great. If that's one of your front office team members who's really passionate about wellness, just two of you guys can literally make this happen in your practice and get everybody on board.
I wanted to say sorry, Dr. Wade.
Yeah, no, go right
and
ahead.
you saying that, it just reminded me of when I was with the team and practicing, we were all calibrated. And that was one of the things that you really, really stressed, that everyone is doing the same, not the same because everyone's different, but the pictures, and we're going to go through this, but that's right. It takes a team of hygienists to make a system work as well.
It does. It does. But you can get it started and not feel like you're dragging the whole team. All you need is one person to really believe in wellness, really really embrace it with you. And I don't care who they are, what position they hold in the practice, but that is the person, the two people that really, you need two. I guess that's all I'm saying. You got to have two people who are ready to get after this and to begin to implement it. If you can get two, then I promise you, when you start seeing the success that we've seen in the real life cases, the real life stories of people that we've changed their lives, like you can't help but the rest of the team want to join in. And it just opens up so many different opportunities. And really that's why I have this slide here, is because it's literally chronic diseases being screened for in the dental office is huge, guys. I mean, this is huge. Just look at it. Let's see. I'll read it to you for a second. It's 153 billion of lost productivity each year due to chronic diseases in the world. I mean, that's a huge amount of money of people. People are off from work with all this extra stress with COVID. It's only going to get worse. We've all heard about the increased percentage of teeth breaking, like literally breaking and fracturing and cracking since COVID has even happened. People are going to need dentists more than ever before. Dentistry. And we can't do what we do online. We can't zoom in and take care of somebody's tooth. We are in the best profession that we could possibly be in for a long-term success. We're going nowhere. People will always need us. We have to remember that as well. But we also have to create a business that can keep ourselves as healthy as possible and our patients as healthy as possible. So all these things that we're talking about are going to be talking about not only today, but in the series itself. You need to be thinking of yourself, yes, as a dental professional and how you're going to extrapolate this out to help your patients. But you need to remember it's helping you as well. You are going to learn how to take care of yourself and how you can enhance your overall health and well-being while you're also doing that for your patients, right, Aurelia? Okay.
I will take myself off mute. Yes.
Yourself
Yes,
off.
absolutely.
Okay.
Absolutely.
So we're going to get started here with the number one secret to wellness dentistry. And that is what we believe it is all wrapped around. Inflammation is absolutely the center of everything that we talk about. It is the heart of exactly where we came at this from Smile with Heart program or Living with Heart program. It's about inflammation. Every chronic disease that we are dealing with, including periodontal issues, is all based around inflammation. Inflammation is bad, bad, bad. If you take nothing else away from today, inflammation is the key and it is bad. Anti-aging, all the chronic diseases that we see. And in this moment in time with COVID, that's what we're talking about as far as comorbidity. The more somebody has inflammation already in their system, either that they know it or they don't know it. When that cascade effect of inflammation occurs, that's how they get revved up. That's how some people get more sick than others. And I truly, truly believe that COVID is going nowhere. So this is something that we're going to have to deal with for many years to come. And I believe that the best way to deal with it at this point is to work on keeping yourself as healthy as possible, keeping this inflammation aspect of your health down to a minimum so that you are not as receptive, if you want to say, to all of the effects of it. Does that make sense? So with inflammation, there are tons and tons of causes of inflammation. So the whole idea behind inflammation is trying to figure out where the root cause of it is coming from. Some of that can be neurological, some of it can be more on a genetical factor. You just may genetically tend to be more inflamed than somebody with your exact same, history, but your genetics are different than the person right next to you, and you may have respond to inflammation worse. Nutrition, we've got also all the different dysfunctional cholesterols, you name it. The root causes are infinite, but when we break it all down into a systematic approach, it can actually make it simple because we take the biggest things first, second, third, very systematically. So you don't have to get confused. You don't have to get overwhelmed. You're just there to listen and to put the system in place and let the system work for you. So the way that we really do this is by considering what we call the circle of health and trying to systematically make it simple for us as providers to get to, or at least point to, the potential root causes of the inflammation as fast as possible. So we don't talk a lot to the patients about what system of your body is not working properly. Are you having stomach issues? Do you know if your thyroid is or isn't working properly? We're not asking them, all about their ovaries. Do you still have them? Are they still working? Are you in premenopause? Are you in postmenopause? What we talk to patients about are symptoms. Symptoms, symptoms, symptoms. When you understand the symptoms that someone is having, then you can work yourself backwards, excuse me, to the actual organs that are maybe not functioning properly, and then back to one of the four core aspects of the circle of health. You'll see this very much routinely in everything that we talk about. We always are going back to these four core aspects of the circle of health: hormones, nutrition, neurons or neurology, and purification, which is more like heart disease, cancer, and things like that. We go into it so much that we've designed our medical history forms to specifically think about that, right? So the team, I'm laughing because, and Aurelia's laughing because we go over this all the time, don't we? All the time. These have been designed to literally, when the patient fills them out, showing us where their symptoms are. If we see an enormous amount of checks and X's in the upper left, section, we can literally within seconds realize that more than likely they're having quite a bit of hormone trouble. If we also see them making a lot of checks and X's in the, kind of lower right inner corner here, then they're where the circle lies in the middle, there is symptoms that could be incorporated into multiple areas, right? So if we see that starting to kind of close in the middle, then we know that multiple systems are not working properly. And Aurelia, I'm going to stop right here for a second. I know that this is going to be one whole hour of our coursework. I know.
Yes.
This
is the most important part.
Yeah.
I mean, and I'm excited to dive deeper into that in the next course. But yeah, it just touches my heart right now looking at it. It's been a year since I've seen it, and I just it's awesome.
What it does is for the providers, be it the hygienist or the docs, you can literally look at this medical history form so fast that I literally, as I'm turning around to get towards the patient, I can literally be thinking in my mind, what do I expect to be seeing inside the mouth? And then I know what I'm going to be starting to look for, and that either is going to confirm it or deny it, right? And then it also allows me to start thinking about the open-ended questions that I want to explore more with the patient. Because it's all about the patient. I mean, really, guys, what you see inside the mouth is the window to what's going on in the rest of their body. And so you've got to learn how to identify the very, very subtle differences that are occurring inside the mouth, on the patient's body, reading them and their body language as you ask them open-ended questions, where they hesitate, where they don't hesitate. Look at their body. I mean, you can tell if somebody, let's say, is overweight. I don't have to have them step on a scale to know if they're overweight or not, right? So you've got to look at them. So that's really the number two secret of wellness dentistry is looking and understanding what you are seeing. So for a office that really embraces this, you must have, it is not optional, you must have intraoral cameras available for every hygienist in every hygiene room. I would suggest that they are the exact same camera so that if the patient from one appointment to the next is obviously going to be in a different room, because how would you might know that they were with the same hygienist, but you wouldn't know if they were in the same room. But if all the intraoral cameras are exactly the same, then you know that the pictures that are to come can be compared side by side, apples to apples. And I think I have a picture of that here in just a second.
And that's the calibration process,
And
right?
that's the calibration
And
process.
this was one of the things, like these pictures, every single hygienist in our office, we knew if we can compare 6 months ago to the treatment that was performed, and we could actually see the progress, and the patient could see the progress of how much better they are getting, gum wise and also systemically.
Right, absolutely. It's a great point. It's proven without a shadow of a doubt that a picture is worth more than 1,000 words, right? So what we love about these pictures is it takes the subjective factor of the providers out of play. The patients increase their trust level via a picture like 100 times faster, because honestly, periodontal disease does not hurt. Okay. It doesn't hurt. So they don't know that they may have it. You have to show it. If you show it in a picture, you can't lie about it. It either is there or it isn't there. The redness either is there or isn't there. The blood is either there or it isn't there. They're not having to take your word for it. Your word will only mean something when you create the value and you show them that you're confident, you know what you're talking about, and then you're able to provide the services that they need and want. That's when your word means something. Up until then, it doesn't. But this really shortens that time frame in which they can create an enormous amount of trust. And it's also a way for us to compare, which is going to be super important to motivate them, show them that they did a good job in some areas, if not in some others, and celebrate with them, because we all need that celebration. But I think the most important thing too is many a times when we see some of this inflammation going on, it absolutely doesn't mean that they didn't brush their teeth or aren't brushing their teeth or aren't flossing, right, Aurelia? It sometimes has absolutely nothing to do with their oral hygiene at home, because this is systemic. This is what is subtly showing inside their mouths systemically, having an oral symptom. Okay.
Yeah.
There's the key that right there. And so this obvious case that's right here obviously isn't got the greatest oral hygiene, but there's many cases where you take these pictures and they look spotless, like their teeth are super clean, super healthy, and they're still having some redness and inflammation going on inside of there. I love it when I get to say, hey, John, I just want to tell you, I know for a fact you're brushing your teeth and you're flossing. I can tell because you are clean. However, the bacteria is already, deep down inside there and is still causing a problem or whatever it is. I like to give them that compliment so that they don't feel like they're being berated when they know that they're brushing and flossing or using their air flosses or, water picks or whatever it is. So I love these pictures because there's so many different stories and so many different things that you can kind of help to move to how to explain things.
And one of the things too, Dr. Wade, is these pictures. I mean, I know there's a lot of people I take intraoral pictures, yes, but these ones, and we'll talk about that in another episode because there's so much detail that goes into these photos. There's a reason why they look like this and what we're looking for. So
Absolutely.
It's not just a broken tooth, but we do take extra pictures when we see something like a broken tooth that's obvious. We'll take another one. So that's a whole other intraoral camera, collaboration on looking at the gum tissue differently.
Absolutely. And this is just a different, it gives you the ability to literally pull some things up side by side and show them things apples to apples, oranges to oranges. There's no they can tell their own teeth. You're educating and training them how to see redness or not redness, or calculus or not calculus, different things like that. And it's just a beautiful way. Like, pick up the intraoral camera if nothing else and get started, because when you can show somebody through that lens of that camera redness that doesn't itch, isn't painful, they don't even know is there, and you tell them that that redness is measuring like 4 millimeters into or underneath their gums, and you show them a picture like this, it's indisputable. They can't dispute that. You're not lying. That's systemic right there. That is systemic inflammation from other things. They don't have great oral hygiene, but it's not because they've got, an enormous amount of plaque. That is so deep in there that that's a bacterial infection. So we are going to go on with diagnosis, the third secret of wellness dentistry. Diagnosis is really all that matters. Like, to us, diagnosing the cause or the root cause of inflammation from a dental standpoint is our job. That is our job. They are paying us for our expertise in our business. It's our job to remember that we are the experts and we must talk to them about it. You don't have to be embarrassed to talk to somebody about periodontal disease. You don't have to be embarrassed to tell them that they have a dental infection. You don't. This is what they come to you for. And it's your obligation to diagnose things properly and to educate them properly so that they can understand, and then to put the right therapy in place. And so hopefully throughout the series, we're going to teach you the confidence of being able to do that, because it's all about the vocabulary, right? How to talk to them about it, what words to use, what are they going to react better to? How are you going to get them to value what it is that you have to offer? And then how are they going to keep up with it? And how are they, what are they going to feel from an overall health and wellness standpoint? And what doctors, do they have? And there's just so much. But this, I get it. It could be a philosophy that you're not comfortable with yet. But that doesn't mean that you can't be, because once you know the science and you learn from us that systematic approach, then you can have a new mindset, and then you can create that new mindset in your patients. So for us, we really do recommend the read or to get the book for all of the team members. Everybody in the whole entire office needs to read Beat the Heart Attack Gene from Brad Bell and Amy Doneen. They are a fabulous duo that trains both medical professionals and dental professionals on this very important, key concept of inflammation being the center of the disease process. And so as far as we're concerned, taking it from the dental professional side, these are the types of things that we must be very, very educated and confident about. We have to understand bacteria. We have to understand what the bacteria does and which ones are more at risk or high risk versus low risk. We have to understand infections, how they work, how we get rid of them. We have to understand periodontal disease. Again, what causes it? What are the classifications of it? And then how to treat it, how therapy goes, and how to maintain it. or to the best health as you can, maintain health as the best that you can. And we also have to understand abscesses, true dental abscess issues. Those are the key things in the dental profession that we have to really get comfortable with. So, number 4, you're like, what's going on? Diagnosis was last time too. So, all of those things that I just talked about are super important. But for the majority of again, the success and the foundation of a dental practice, it is crucial that everybody in the office understands the diagnosis of periodontal disease. Periodontal disease in most offices, I would love to think that everybody grabs a probe and everybody understands what a probe is, and every patient gets probed and everybody hears the numbers that are being called out. Believe it or not, there are still many, many places in this country that I just don't think that they put that as a high priority. To me, periodontal disease is tricky to diagnose in early forms and in early stages. Late phase periodontal disease is not hard to figure out. You can smell it from across the room. Those aren't the cases that I'm worried about, guys. Those probably need to be shucked and go on to all on fours. You know what I'm saying? That's probably going to be the best help that they can have. But for everything that is a late phase, was there not a middle phase? Was there not an early phase? So we have to become so much better at diagnosing early phase disease. And here's where the problem is going to end up. And this is a philosophical debate that I won't do right now, but I will make a statement because it's getting worse. I no longer care what insurance considers periodontal disease or not. I know early phase periodontal disease. I'm going to treat early phase periodontal disease, no matter if the insurance is going to cover it or not. That is not my responsibility. My responsibility, again, as an expert, that patients are coming to me for my expertise, is to educate, diagnose properly, and treat properly, period. So we're already finding since we've returned from COVID that there are more and more constrictions on what the parameters have to be for insurance to be paying towards what they call scaling and root planing, or what we call periodontal therapy. And I cannot be okay with some of the parameters that they're putting on it at this time. So I'm just going to have to be a really big voice in a really big ocean. But together, as the professionals decide what needs to be done, then we can have almost a grassroots voice together. Why is it so important? Because there's more than just the probing depths to consider on this kind of early, middle, or late phase periodontal disease. Yes, we have to look at bone loss, but just because our pocket probing depths may not be deep, but we already have the bone loss process in progression. We're losing the lamina dura in between some of the teeth, and we can see that that's gone. That is disease, in my opinion. Yes, bleeding, okay, but does every spot have to bleed? No. I literally have seen people, and then the pathogens and the way that we isolate the pathogens. We are true believers in oral DNA. There's several other companies out there. You'll almost always see my practice with oral DNA results. One of those reasons is just because I've done it for so long that I like that consistency, that I have the apples to the apples. I'm probably, like most dental professionals, a little perfectionist on that. I like to see it exactly the same way every time when we retest, to be sure that our therapy has worked, and then also to retest a year out, 2 years out, different situations with somebody's health has changed. I want to double check and make sure that we haven't let any bacteria overtake someone whose immune system has dropped. So this whole thing with COVID has really allowed a lot of people's immune systems to drop, and we're having to basically go back in and do some more therapy on some people because it dropped down enough where the bad bacteria really kind of took over again. So, you know, some people's concept is that they've got to be bleeding everywhere and they've got to have 5 millimeter pockets everywhere. This is just not true. You can already have the start of periodontal disease going on with just literally a couple of pockets of 4 millimeters and a couple of bleeding sites. The rest of the mouth may look pretty darn good, but what are you going to do? Watch it like watching a small cavity? You're just going to watch it get bigger? Like, if you know it's there, why not deal with it? Why not take care of it? Why not go on and treat it? Because what you've got to remember is it has an influence on the systemic body. These oral DNA samples, when we take it from the mouth, from the saliva, is a representation of what is going on inside their entire body's arterial system. And so, yes, we as dental professionals are concerned about what's going on in the mouth, but take it another huge step past that and consider what it's doing to their whole arterial system. And if that inflammation and bleeding is what you're seeing in the mouth, it's happening exponentially throughout their whole body. And again, we're trying to protect their heart. We're trying to protect them from a stroke. We're trying to protect them from a lifetime of damage from diabetes, which then almost always leads to cardiovascular issues.
Yeah, and that's one of the things for me, when I was learning the wellness program, I had to think about that. I really, that hit home with me. And as soon as there was one area in the mouth that was 4 millimeters and just bleeding, this is just talking about bleeding, that's just going on anywhere. Your body's fighting that infection constantly. And if you're already immune compromised, you already have heart disease, you already have rheumatoid arthritis or diabetes or Crohn's disease, your system's already in a state of inflammation. So if you can take care of that, it's helpful for the rest.
It is, because I don't think any of us think that we can correct everything. Okay, so maybe we can't correct everything, but every little thing that you can correct and get inflammation to subside, in total, you can make a big, big difference. And I just threw this up because I think it's the old thought process of what the probing depths have to look like to say we've got periodontal disease. But I'm here to tell you, I have seen a case, this is a case on the left-hand side, of someone who is in periodontal disease from an oral DNA pathogen standpoint. And when you look very closely at the x-rays in these areas of these slightly deeper, there is no lamina dura. The process has begun. So are you going to deal with it before it has major bone loss? Or are you going to deal with it now? Our patient base comes to us because they want to deal with it now. These are different, just kind of, actually, that is the probing depths and the DNA from the one that was on the right and the one that was on the left. Okay. And if you see, that one on the left has a huge red flag for heart disease. I don't even care that it's not over threshold yet. And that's going into a little too much detail. Sorry. We'll get into that later.
We'll have that hour again.
We'll have that out. But that's a scary result right there. You don't want that bad bug in there, period.
And if the person's medical history was they already have high blood pressure or any type of heart disease, that's major. That doesn't look major, but it is. And this is where that education comes in. And when they can see these things, patients are not like, you're a liar. That's where that confidence comes in as a hygienist. I just wanted to say that because of the approach that we take, it just is a no-brainer. Then they're like, oh my gosh, they see it. They see the pictures, they see the probings, they see the oral DNA. You talk about the bacteria, their heart disease. Oh, it just gives me goosebumps right now thinking about it.
Yeah. This is what is exciting though, isn't it? This is what excited you when you were there. This is what still excites you now. And I know there are hundreds of thousands of dental professionals out there that this will excite them too. And this is what changes lives. This is what saves lives. So moving on, I've got the number 5 secret of wellness dentistry is 3D technology, cone beam technology. It is a must-have, and I know they're expensive, and I'm not necessarily saying that everyone can afford one of these in their office, but I would hope that you could find someone in your local area that does and reach out to them and connect with them. I will give you a super first place to start. That's going to be with your oral surgeons in the area. Some people who are placing implants more than likely have 3D technology in their office. And it's time for you to work out some type of system with them to have someone that is wanting to go down this approach to be able to go over and have a 3D cone beam taken so that you can get it sent off to someone like a beam readers or something like that to help you diagnose dental infections. That is our job. We must diagnose dental infections. Cone beams can be placed in corners, take out a closet you don't need anymore, replace your pano with this, whatever it takes. You're going to need to have access to that. There are just certain things that cannot be seen anymore in traditional 2-dimensional x-rays. We have both. Obviously, we take pictures of both, and we get to the course in 3D technology versus 2D technology. We will show you over and over and over and over and over again how many times in 2 dimensions we have not been able to see something that when we simply add the 3rd dimension of being able to see around the teeth, that our eyes have been opened, that there's something going on, be it a true dental infection, or be it just a tooth that looked normal on 2D but doesn't look normal on 3D. And then we also, sorry, I thought there was another picture on there. I must have taken it off. We can also look on the 3-dimensional cone beams because of where they take in that on the head. Okay, we can actually see arterial calcifications in the carotid artery area. And so when we send it off to cone beam readers, we're not only looking at, and here's my next little thing, but we're not only looking at the dental infections themselves, we can look at a general bone loss level, but we can also look for the arterial I keep wanting to say calcifications, and we can look at the airway space, because we know that breathing and sleep is so much a part of increased inflammation in somebody's body as well. So you get so much detail from these records, but it's also another tool. Let me give you a hint here. You will become known in your area from other medical professionals, especially professionals who are doing like functional medicine, concierge medicine, cardiologist, ENT specialist. You will become known as the dental office that understands these more medical aspects. This too will bring in new referrals for your business. So again, fundamentally, really helping to increase your business itself, the bottom dollars that can come into the business, and create these relationships with other professionals in town where you can have working relationships side by side. But doctors, physicians, cardiologists, all these guys are very used to reading what? Lab work and lab reports. We in dentistry are not as used to that, but you will need to have these types of things being read by the beam readers and different radiologists that create a report for you, the reports on the oral DNA. This is how you will communicate back and forth, allowing the doctors to understand what it is that you're doing and when you have your success. Do you want to comment at all on that, Aurelia?
Yeah, I do. I just think that, I mean, that's a true statement. I mean, when you're working and networking with medical physicians that are helping the patients go through, medication changes or heart disease or, blood pressure or blood sugar, diabetes. Again, I don't know why I'm forgetting my words here. These are all important. Yeah, these are all important things to that. They read lab work. So when you go into having more comprehensive, diagnostic material for your medical physicians, then it's a team effort, and you're actually helping your patient more. And yes, when you start practicing this way, you do get more referrals. I mean, because they're trying to save their patients' lives, and they know that they should know that periodontal disease, hidden dental infections are inflammation in the body that a dentist needs to fix. And that's where that all comes together, and there's you join forces there. So yeah, very powerful.
Absolutely. And we mentioned a couple, but this is a true opportunity for you in your area to have some new sources of referrals. I mean, who doesn't want that?
Yeah.
Like, everybody is looking for that at this point in our careers. There's nobody who doesn't want that, right?
Yeah. And one of the things too, Dr. Wade, I mean, I'm going to have Dr. Chowdhury doing her series on Dr. C's 6 healthy habits. And Dr. Chowdhury is someone that you personally work with, and I worked with hundreds of times, and she would send patients to us, and we just did the systematic approach for her, because she also does follow the Bale and Doneen method of preventing a heart attack and stroke.
That needs to be
saving a life.
Series all on its own. Just how to read the blood work from Bale Doneen stuff, right?
Yeah.
So much fun. So many
So
different
much fun.
things you can go do. So let's talk about this. There's a ton of people in this country right now, especially in dentistry, who believe in some type of sleep care, sleep aspect to their practice that they've added. Everybody's a little bit different on how much they've gotten into it. But if you haven't gotten into it, I'm just going to tell you, it's one of the secrets to wellness dentistry. We must think about sleep. We are the airway space, not just the mouth, but the nose is certainly right here in our zone, and we must think about it. We capture that as well in our cone beams, and we do ask the beam readers to sorry, just want to make sure you were still there. And we ask them to comment on the nose in case there's any deviated septums or issues to the point where they can't breathe through their nose, because we just know that without restful, healthy sleep patterns, that we're never going to get them as healthy as we could. We're never going to get as good of results on our periodontal therapy as we would like. This is just an excerpt from Bale Doneen in the thought process that just like a tree, there are root causes of inflammation, and we have to put on our detective hats to figure out where the inflammation is coming from. So if we do everything that we know to do, we've taken the cone beams, we've identified dental infections, we've taken care of the dental infections however we needed to, we've treated the periodontal therapy, we're getting oral DNA results back in, and we're clear from that type of disease, then what's next? There's more things to keep thinking about and keep working with. Some are not in our wheelhouse, but it's still our part as part of their healthcare providers, their team of healthcare providers, that we have to start thinking about. And in all honesty, guys, because we spend more time with our patients, we take more thorough medical history, we have and see them on a more regular basis, we still have to consider all of the other root causes, because sometimes we as professionals are the ones who are acting as, let's just say, the orchestra leader. We have I see this many times over and over again. We know more about medicine than medicine knows about dental. And so because of that, we have to still be familiar with everything else that's going on and be able to point the patients in the right direction if we know that they're still having problems. And sleep is just a huge harder piece of it. So if you have an aspect of your practice that's already sleep, Great. We're just going to enhance it even more. I just got a Celea laser in the office. Aurelia hasn't even seen this yet, but we use it to help open up the airway space and to help with snoring. But it's really for me opening up that airway space to allow people to get more oxygenation and better breathing at night. I just put that up there in case we needed more things to talk about, but I think we're doing great. I'm just going to keep going on the number 7 secret to wellness dentistry, which is stress and hormones, which is probably one of my most favorite topics to talk about in the whole wide world, because I just don't think that people understand stress enough to realize what it is doing to their bodies. Stress is basically maintained or what am I trying to say? Maintained at a good level, or can have that kind of up and down roller coaster depending on hormones. Hormones are what also make us fall asleep or not fall asleep, wake up, sleep well, don't sleep well. It has a tremendous amount, and I think it's extremely underestimated on what it can do to our overall health and well-being. When you have maybe different body types, yes, it has stuff to do with your nutrition, but it also has ultimately a lot to do with where your hormone levels are. And again, a whole course just on this, that you just go so many different directions on hormones. And we actually can see adrenal fatigue inside the mouth. We can see different types of thyroid imbalances, and dry mouth, dry tongue many a times has something to do with, if they're not taking certain types of medications that can do it, then the next thing to look at is stress and hormone levels. I know this is one of Aurelia's favorite subjects, nutrition. It's the 8 secret to wellness dentistry. I also believe there's someone much better and more knowledgeable than I on nutrition. However, we will discuss it to some extent in our course as well, a little bit more on the scientific side of things and how that actually relates to the mouth itself. But Aurelia, you want to share, because we have a great friend, Uchi Odawatu, who is amazing with nutrition, and I know he's going to do a series for you.
Yeah, his series is the nutritional Lollapalooza festival. Because we have Tracy Butler's the Gums and Roses tour, which is amazing too. Basically, she's got the same philosophy on hygiene and tooth replacement with implants and just meeting the patient where they're at. So yes, nutrition is. It just brings me back to a patient that I had, and I can't obviously say his name, but a young guy, and he had Crohn's, and that whole, I mean, gives me goosebumps right now thinking about how much we helped him, Dr. Wade, and gosh, it just how much inflammation in the mouth and opening the airway and doing all the wonderful things that we did to him. He's just much better now. And that's Crohn's disease is huge, and that is that affects the gut health and all that. So yeah.
And I think, if you call yourself I'm trying to think of all the different terms I've heard of dentistry, oral medicine, all those kinds of different things. You have to realize that nutrition starts in the mouth. And so to think that we cannot address nutrition, we didn't address it as much in dental school when I was there as we should have. I would hope that they address it more these days, now that we know more about gut health and things like that. But I just don't know if they do. And so it's our time to definitely in this series be talking about nutrition, because again, it's the window. The mouth is just the window into the whole system, and definitely the gut system. So what you're seeing in the mouth, you have to be thinking that we're not just the part and piece right there at the top, like that's attached to everything else. And so what you are seeing is truly a window into what's going on, and what they're eating is affecting their blood sugars, and that's affecting their ability to heal. For us, and their implants and post implant issues. And so
And the other thing is,
it's
Dr.
it's the
Wade,
whole
is
body, right? It's the
yeah.
whole body.
I mean, we go as simple as acid reflux, which is, yes, that is a nutritional deficiency. That is something, but there's more to acid reflux than just
Absolutely.
then hey, you're eating some hot salsa every night and you're messing up, right? Yeah, what are you doing? Because that comes with airway, and I mean so much. And I'm so glad we're going to make this a series, because there's just so many beautiful things we could talk about to get our patient, to teach our secrets to get our patient to the ultimate health. So
Absolutely. Yeah, so much to cover. Um, Obviously, we're just hitting the top 10 secrets right now, but just like you said, acid reflux, it's a huge secret that I didn't even put in here. But I guess you could put that under nutrition. Absolutely, absolutely. So number 9 secret to dental wellness is genetics, and I think I alluded to that earlier. Is that every single patient that comes into your practice is similar but different. And so what makes them different is their genetics, and it is what it is. A lot of times we ask certain questions about family members and what they've had issues with, because again, if you're trying to figure out what that person may or may not be having issues with, why can't you take a little hint as to what 10 of their family members have had? If they're all diabetic, what do you think the likelihood of them being diabetic might be because of a genetic tendency for it, or high cholesterol, different things like that. So thinking about and asking open-ended questions about their family isn't because you're trying to be nosy and prying into their family. It's because you want to consider that that is a hint to a genetic possibility without actually knowing their genetics. If somebody does really understand their genetics and has had a lot of genetic testing, oh my gosh, we can just open that up to a whole nother level of conversation. Because when you understand what they truly are, more genetically tendencies are towards, then you know if you need to really push hard for maintenance, additional maintenance tools like perioprotectorase, eco system, whatever, because genetically they may just be more predisposed to inflammation because of their genetics. That's where I come from that. I popped this in. This is kind of halfway in between nutrition and halfway in between genetics, but we know APOE genotypes. If we get our hands on APO genotypes from our physician friends, then we know exactly what's going on and what they need to be staying away from, how much exercise they need to be having, what kind of more diets that we need to be recommending for them. And again, won't go into the details today, but there's just so much. I'm hoping that you're seeing. I just want to open up your mind to this new mindset that it's not just the same thing maybe that you've always done. There's more to it. There's more science out there that can help you really get down to the root cause of why some of your patients don't feel so well and why you don't get the results. You do the same therapy maybe every single time. Why does one person um react really really great to it and really cleaned up and looks great, and why did somebody else not get the results that you were quite looking for? And
and
that's what
again,
we teach you.
and that's where it's like they come in with plaque all over their teeth. Yes, you know that their oral hygiene is not, they're not doing their part. But if you don't have plaque, but you're still getting, you do oral DNA like 3 months later, which is, we'll talk about the process a little bit more, and they still have a burden of pathogens. Like, what is going on? I mean, what's going on here? So yeah, there's so much to it. And the APO, like that's a whole other topic in itself. And I know Dr. Chowdhury in her series, she'll probably be talking about that more too. But I would like for you and I to talk about it on a dental in a dental portion in the next another
Absolutely.
course. Yeah. Yeah.
Absolutely.
Yeah.
And to me, that last secret of wellness dentistry, and I'm going to say this is like top level thinking, like above and beyond just dentistry, is really all of the what we call advanced inflammatory tests that come more from the medical side. The more you understand what those are, the more you can communicate back and forth with the physicians like they need to be talked to. Understand that when you are asking for their test results, that you know how to read them, and then how that is going to help you uh, give your opinion to the patient on what they should do. Now you're talking next level dentistry and wellness, because basically what you're doing with all these secrets is just honing in on the root cause of the disease. And I'm telling you, patient after patient have sat in my office and cried to me because they've said, I have never had any other medical professional sit down and talk to me like this and make me understand what you've just made me understand in the last 10 minutes. And it makes me sad, but it also makes me happy because we're doing our job. Makes me sad that they haven't been able to receive that type of information from, a medical provider. But hey, they can receive it now, and then what they want to do with it has been extraordinary. They just needed to be pointed in the right direction. And so back to that whole thought process about the circle of health, and being able to simplify it enough to simply be able to help them point themselves in the right direction, because the medical profession right now, I'm going to say not even the profession. The professionals of medicine are amazing people. They're doing incredible things. And we're so grateful to them for everything that they've done for us. They've really stepped up to the plate in the last 2 years. Okay. So I'm going to rephrase what I said and say the medical industry has not allowed for them any longer to run a business in which they can give of their time, expertise, and knowledge. And unfortunately, it is creating a catastrophic effect on how well our country is. Okay. And so we have the opportunity in dentistry to slide in and be the answer for that problem. We were built on prevention. We understand prevention. We have the time with them. They already consider us preventive people. And we can take that opportunity and really expand on that in the next 1 to 5 years, because somebody has to step in this place of figuring out how to identify inflammation. One of our series is definitely going to spend a ton of time on red flags and understanding your risk factors, the more of those red flags that you have. And that whole information is mind blowing. So when I say mind blowing, again, I don't mean just for the sake of your patients, but for you, because you are a patient as well. You need to be understanding your own red flags. And when you start to go through these red flags with us, you are going to be surprised at how many of you or your loved ones have these red flags. And you are going to have a totally different perspective on what you do and what you tell them to do and what your encouragement then becomes. And it's not hard to a concept to understand. You just didn't know what the red flags were. So just even going through a piece of paper like this, handing it out to your patients, allowing them to circle things. And I always tell the team, it's like baseball. 3 strikes, you're out. If there's 3 of these things, you're done. You're in inflammation. If you've even had it but don't have it currently, you still need to be in a revved up situation where you are trying to get rid of as much inflammation as you possibly can, because you're already at risk. You are already at risk. And so something simple, again, 3 strikes, you're out. Do people understand that? They do. Hand them the piece of paper and let them circle what they've had, having a problem with, or have had problems with. And when you understand either the testing or the red flags or what kind of medicines and prescriptions they're already on, I'm going to teach you how to consider this picture right here in your brain all the time. This is what it's all about: inflammation inside the arterial walls. Not making the lumen smaller, which yes, it does as it gets more over here to the right, but what is happening inside the walls themselves and where the risk factor occurs to actually having an episode, a stroke, an aneurysm, or a heart attack. when you can understand this and understand that everything that we're going to do is going to try to shift you back towards the left, that is what is helpful. Periodontal therapy helps do that. Taking care of abscesses helps that. Getting somebody sleep better helps this. Okay. And I think the biggest myth is that cardiovascular disease is not reversible. And I'm here to tell you, we see it all the time. It's reversible. That's why we can save lives. That's why we can change people's lives. It's because it's reversible. So there's my email address in case anybody needs it right now. But you know how to get in touch with me through Miss Aurelia, and I don't know why I have that. I think that's where I was gonna stop because I could keep going forever.
Yeah, Dr. Wade. I don't know. I'm gonna write everything out with your information and contact information. Just questions and everything like that. So, one of the things, hygiene with heart, that's what we call ourselves. Is why
at this point in my career, in Aurelia's career, it has to be about something more, right? It can't just always be about the calculus and the bite wings to show that you just got the calculus. It's got to be about more. And when you can make it less about the individual teeth or less about the individual services that you're providing for your patients in the office, and you become this type of wellness practice, guess what happens? Patients are more loyal. They value you and your opinion. They say yes to treatment. They say not only yes to your periodontal treatment, but also to your comprehensive treatment, because they know that you care more about them than just their teeth or just their dollar bill. And that will make a huge difference in the business of
dentistry.
And so if we can teach more and more practices to practice that way, we're not only helping you, the professionals, but we're helping all of your patients too. And that is extremely important to us.
Yeah.
We want to affect millions of people and millions of people with change, not just a couple of thousand people that we can affect in our own offices.
Yeah.
Yep.
Thank you. Thank you so much, Dr. Wade.
Thank you. I had fun.
I had fun too. Okay, so we'll see you guys in the next course.
Yeah. Awesome. Thanks.
All right. Have a great day.